One thing that COVID-19 has shown us is that we have more sophisticated systems for watching movies and navigating our cars than we have for saving lives in the ICU. At Potrero, we're working hard to change this. Today, our Accurant systems are making a significant impact on 3 areas in the intensive care and COVID-19 focused units. First, through remote vital sign monitoring, it's helping to reduce clinician exposure and the need to don and doff PPE to enter the room for data collection. Second, it can help identify early drops in renal performance and the acute kidney injury that's often associated with it through continuous urine output monitoring. And third, it is a critical piece of fluid management, helping to maintain the ideal fluid balance for the patient, an essential driver in their recovery. Today, hospitalized patients have an increasing number of comorbidities: congestive heart failure, diabetes, hypertension. It has become the new normal. And the sicker they are, the more challenging fluid management becomes. For COVID-19, the problem is even worse. A lack of fluid intake combined with significant fluid losses through diarrhea, fever, and respiratory stress means that patients are arriving with severe volume depletion. The first thing that you want to do is give them lots of fluids, but you can't. Their lungs are in the middle of a war. Too much fluid, and you flood the lungs, and your patient is on a ventilator longer and in a worse position. Too little fluid, and the organs just don't get the oxygen they need. The first organ to suffer are the kidneys. What you need to do is hit a very small target: perfect euvolemia. It's a precise fluid balance between ins and outs. But even in a normal clinical environment, euvolemia is challenging to achieve. For ins, we have incredibly sophisticated, accurate, and automated technologies. But for outs, we have archaic technology that is manual, tedious, and highly variable. That's because for outs today, the nurse must enter the room every hour and do 3 things. First, they must milk the line, which is picking it up and coercing the urine that's trapped there into a collection bag. Second, they must manually and visually measure the increased volume in the bag. And last, they must chart it into the EMR. With Accurant by Potrero, all of this is automated. With precision ultrasound and active drain line clearance, you'll never have to milk the line again. Here's how we do it. We've evolved the traditional Foley catheter with sensor integration and connected it to a bedside automation and analytics system. We have also added a remote data interface that enables you to monitor and collect the data from outside of restricted access rooms. Together, this platform provides automated urine drainage and measurement, IAP at the push of a button, and core body temperature, all of which can be monitored from outside the room via EMR connection or with the AccuTab remote interface. The result is vital information from the bladder and kidney that is accurate, continuous, and remote. And here's the impact. We've seen a significant reduction in clinician exposure and the need to don and doff PPE. We know this because our systems are in COVID-19 patients right now. Today, they're helping save lives. Through our frontline access and support program, hospitals have been able to acquire and deploy our systems into their ICU in under a week. And with our AccuTab remote interface, nurses and doctors have been able to access the critical data they need from the hallway, reducing their exposure risk. One nurse shared her experience and described a 60% reduction in room entry for data collection alone. We can also help identify early stage kidney injury, which has been a significant problem in COVID-19 patients. Recent US clinical data showed a 36% occurrence rate in hospitalized patients. But this data was driven off the serum creatinine criteria alone, which is well understood to be a lagging indicator of renal dysfunction. Urine output, on the other hand, is an early indicator, but it was not used because the data in the electronic medical record was unreliable, a narrative that we commonly hear when talking to clinicians. The result is that early stage kidney injury is going largely undetected. When one center was able to use the urine output criteria, the AKI rate skyrocketed to 85%. With Potrero, patients are automatically and continuously monitored for changes in renal performance, and the clinicians can easily identify and stage AKI based on KDIGO. We can also help support euvolemia in maintaining the ideal fluid balance. This is important because the world's leading pulmonologists agree that for COVID-19 patients, fluid management is essential. It keeps fluid out of the lungs. Unfortunately, most of the time we only have half of the information needed to maintain fluid balance, precise ins. The Acuren platform delivers the missing half, precise outs. With Acuren, you have the full picture and helping to maintain the ideal fluid balance for your patients. At Potrero, we are building the future of critical care medicine and helping you fight COVID-19. Please connect with us at the link below to learn more about how we're helping your colleagues today. Thank you.